coffee? What are the uses, side effects and precautions? People drink coffee to relieve mental and physical fatigue and to increase mental alertness. Coffee is also used to prevent Parkinson's disease, gallstones, type 2 diabetes, gastrointestinal cancer, lung cancer, and breast cancer. Other uses include treatment of headache, low blood pressure, obesity, and attention deficit hyperactivity disorder, ADHD. Rectally, coffee is used as an enema to treat cancer. Coffee enemas are used as a part of the Gerson therapy. In the Gerson therapy, cancer patients are treated with caffeinated coffee in the form of enemas every 4 hours on a daily basis. How does coffee work? Coffee contains caffeine. Caffeine works by stimulating the central nervous system, CNS, heart, and muscles. Uses and effectiveness: mental alertness. Drinking coffee and other beverages that contain caffeine throughout the day seems to increase alertness and clear thinking. Caffeine can also improve alertness after sleep deprivation. Combining caffeine with glucose as an energy drink seems to improve mental performance better than either caffeine or glucose alone. Reducing the risk of colorectal cancer. Some research suggests that drinking more than 3 cups of coffee daily may significantly reduce the risk of rectal cancer. Preventing dizziness in older people caused by low blood pressure after eating a meal, postprandial hypotension. Drinking caffeinated beverages like coffee seems to increase blood pressure in elderly people who experience dizziness after meals. Preventing or delaying Parkinson's disease. There is evidence that people who drink caffeinated beverages such as coffee, tea, and cola have a decreased risk of Parkinson's disease. For men, the effect seems to depend on the amount of caffeine consumed. Men who drink the most caffeinated coffee, 28 ounces, 3 to 4 cups, per day, seem to have the greatest reduction in risk. But drinking even 1 or 2 cups of coffee cuts their Parkinson's disease risk significantly. In women, the effect does not seem to depend so much on the amount of caffeine consumed. Moderate consumption of caffeinated coffee, 1 to 3 cups daily, provides the most reduction in risk in women. Interestingly, coffee does not seem to help prevent Parkinson's disease in people who smoke cigarettes. Preventing type 2 diabetes. Drinking caffeinated coffee seems to significantly reduce the risk of developing type 2 diabetes. As caffeine consumption goes up, the risk of developing diabetes goes down. But the effect seems to be different in different groups of people. Possibly ineffective for reducing the risk of digestive tract cancers, including esophageal, stomach, and colon cancers. Reducing the risk of breast cancer. Side effects. Coffee is safe for most adults. Drinking more than 6 cups/day might cause caffeinism with symptoms such as anxiety or agitation. People who drink a lot of coffee every day may need to drink more coffee to get the same effects. They may also become dependent on coffee to the point that they develop withdrawal symptoms if they suddenly stop drinking it. Coffee containing caffeine can cause insomnia, nervousness and restlessness, stomach upset, nausea and vomiting, increased heart and breathing rate, and other side effects. Consuming large amounts of coffee might also cause headache, anxiety, agitation, ringing in the ears, and irregular heartbeats. Drinking unfiltered coffee can increase total cholesterol, low-density lipoprotein, LDL, and levels of another type of blood fat called triglycerides. This might increase the risk of developing heart disease. Using coffee filters helps to reduce these effects on cholesterol. There is some concern that drinking more than 5 cups of coffee per day might not be safe for people with heart disease. But for people who don't have heart disease, drinking several cups daily does not seem to increase the chance of developing a heart problem. There is also concern that occasional coffee drinking might trigger a heart attack in some people. People who usually don't drink more than 1 cup of coffee daily and also have multiple risk factors for heart disease seem to have an increased risk for heart attack within an hour after drinking coffee. But people who regularly drink greater amounts do not seem to have this risk. Coffee might be unsafe when given rectally as an enema. Coffee enemas have been linked to cases of severe side effects including death. Special precautions and warnings: pregnancy and breastfeeding. Caffeinated coffee is probably safe for pregnant women in amounts of 2 cups per day or less. This amount of coffee provides about 200 milligrams of caffeine. However, drinking more than this amount has been linked to an increased risk of miscarriage, premature birth, and low birth weight. These risks increase as the amount of coffee the mother drinks during pregnancy increases. Children: it may be unsafe for children to drink caffeinated coffee. The side effects associated with caffeine are usually more severe in children than adults. Anxiety disorders: the caffeine in coffee might make anxiety worse. Bleeding disorders: there is some concern that coffee might make bleeding disorders worse. Diarrhea: coffee contains caffeine. The caffeine in coffee, especially when taken in large amounts, can worsen diarrhea. High blood pressure: drinking caffeinated coffee might increase blood pressure in people with high blood pressure. However, this effect might be less in people who drink coffee regularly.